G'day, my name is Danelle Moraes and I'm the Marketing Manager at Bestmed Medical Scheme. Cancer remains a disease that affects the global population with increased intensity. It accounts for millions of deaths annually. The prevalence of cancer has increased since the beginning of the pandemic. The oncology landscape in South Africa has shifted in the past 4 years, and the COVID-19 pandemic played a central role in the rising number of cancer cases recorded. Today, we're joined by Dr. Dion Kapp, the Executive for Managed Healthcare and Service Providers at Bestmed Medical Scheme. Dr. Dion, thank you for joining us. So in line with worldwide trends, Bestmed has also recorded a steep increase in cancer prevalence between 2020 and 2022. Dr. Dion, what are the possible reasons for this increase?
Now, that's a very important question, and it's actually a very concerning fact that you have stated there. So one might have expected that this could have been due to the increase in preventative care measures, which in fact is not the case. And we also know that there's no known direct link between COVID and cancer. So what we've seen is a knock-on effect of the COVID, especially your hard lockdown component. And I think many people were scared even to go to hospitals in fear of getting the virus, not attending the specialist visits, going for pathology and the like. So I think that in all probability was the main cause for this dramatic escalation in cancer cases.
So cancer cases in South Africa are predicted to almost double by the year 2030. These numbers are also impacted by an aging and growing population. What are your thoughts on these predictions?
Now we did internal investigation and data analysis, and those figures align with what we've heard, and that is very, very concerning. As an example, breast cancer showed an increase from 2020 to 2022 by roughly 35%, and for prostate cancer it was almost 45% increase for those 2 years, which is a huge, huge concern. So if one looks at the increase in incidence, I think there is a very good case to be made. How many of these cases could have been picked up much earlier, maybe even 2 years ago.
And has the increase in cases also increased the cost of treatment?
Indeed, significantly so. So we've seen from benefits paid that there was an increase for oncology treatment, roughly about 47% year on year, which is very, very significant. In addition to that, we've also seen that the radiology cost have increased by another 19% for the same period, given that radiology is very important in terms of diagnosing and then monitoring your oncology cases going forward.
What are some of the major factors affecting the increase in treatment costs?
Advanced stage cancer diagnosis, which in all probability could be to the lack of preventative care tests and measuring taking place, would probably be the most important one. Added to that, once the cancer has spread, the cost for the novel treatments becomes a huge problem, because then one moves into the direction of your biologics and your very expensive medication. And what we've also noticed on the data is that a number of patients don't comply and they don't go for the follow-up visits.
Thank you, Dr. Dion. You've made some valuable points to note. So in the unfortunate event that a Bestmed member is diagnosed with cancer, what benefits are available to them?
So now Bestmed will fund all cancers under the Bestmed Oncology program, provided that there is pre-authorization, adherence to clinical protocols, and pre-authorization. In terms of your more expensive medication like the biologics and the like, there will be a limit for every option, and the available limit will then apply for your above BMB level of care treatment.
A cancer diagnosis is hard news to receive, but with early detection and treatment, the prognosis is always better. Bestmed members are encouraged to make use of their preventative care benefits, mammograms, pap smears, and prostate exams. This helps ensure they know what their health status is and how to best manage it. Thank you, Dr. Dion, for your time.
Thank you, Danelle. Appreciate it.